Thanks, Albert. You are doing really a great job, and the way you are doing it is very important. You have covered almost all the topics, like the aim with which you are promoting the active, healthy living in your amongst your employees, with healthy eating habits, mental wellness, and your this 3M project, like move, munch, and mind. So if you integrate all these things, na, definitely your employees will get more involved. Only my concern was when you started all these programs, there was participation was very less. Like for the weight control program, also how what you did for improving the participation amongst your employees?
Yep. Does it work?
Yeah.
Okay. Sorry. Yeah. So if you notice, the participate. Yes. So we have 9,000 employees, but the cohort that we did was actually only in Malaysia. So in Malaysia, we have got around 3,000 employees. One of the key things that drive participation in those programs is definitely reward. So what we come up with the year after that, we come up with really like very attractive reward system that involve cash. So I would say in previous years, we try to give reward in the form of gifts or coupons, but that doesn't seem to be attractive enough. So when we convert them into cash, people start, getting very excited about that. Yeah.
So there should be some motivation factor for them to get involved in the programs.
Definitely.
So your this going digital and stay connected was also very impressive, and the health outcome and value creations and this waste watcher challenge. So these taglines were very good, because if you go and ask them, we are conducting a program for obesity management, no one will agree to come to it.
True.
So if you say it is waste watcher challenge, definitely everyone will come and join. Then stress management and personal resilience workshop, that was also very good. And this mind guardian counseling skills. This is also mind guardians is very nice, tagline which you have taken. So why you decided like Monday and Friday you want to get involved with your workers? You said now on Monday and Friday.
It's Monday and Wednesday.
Wednesday you said.
Wellness Wednesday.
Monday is for active engagements. Yeah.
Monday is for our mindfulness, because what we one is because it rhymes, my mindfulness Monday, MM, and number two is because we feel that it's very important for our employees to start the week right.
Yeah.
So by having these mindfulness practices, so when they're still fresh. We also feel that, because mindfulness is for me, because I've done it personally, and I find it is a very useful tool to manage my emotion, my mental health. And I feel like by introducing this simple tool to our employees when they're still fresh at work, so it is something that I feel it's very, very beneficial.
Yeah. So the days were not randomly decided. It was very mindful selection of the day.
Yep.
When you start the week, you start with mindfulness.
Yep.
And on Friday?
On Friday, Friday we tend to make it a bit more relaxed. In fact, our HR and many of our leaders try not to have important meetings on Friday. So Friday itself is more relaxed. And a lot of our colleagues are actually working from home on Friday. So our human resource introduced flexi work beginning of last year, following the pandemic. And many people actually work from home on Friday, and either Monday or Friday. And that's why our Wellness Wednesday is conducted on a Wednesday, where every employee is on site, where we can have the engagement session on Wednesday.
Okay. So it was a very well thought of strategy. And your HR, how you involved your HR in this? Because many things they are being conducted by HR.
It's true.
And since you are in HSSE, I am in HSC, so we have to develop some strategy to rope in HR activities also. No?
It has been a journey trying to convince HR. And I would also like to share that when I joined the company in 2017, obviously they did not have a doctor looking into health and well-being program. And in 2019 and 2018 and 19, when I started rolling out this program, obviously they were supportive, but they were not, I would say, 100%. But it was good to see that in 2020, there was a big shift in how HR get a bit more involved. And in fact, in their strategic planning, they have never included health and well-being in their strategic planning for HR strategic planning. But in 2020, they actually have got health and well-being agenda in their strategic planning, which I think, in a way, I feel like I have managed to influence them and get their support to drive the health and well-being agenda.
Yeah, that is very important to implement your strategies at ground level.
Yep.
Sir, you was...
Yes, I was telling, your idea of cash incentive for employees to keep fit is a wonderful idea. I think that should be copied by others also, because it is a very strong incentive. The money is a very strong incentive.
Yep.
But I don't know how you managed your finance people for this proposal.
Okay, so that's the key thing is, that's why I keep stressing on the leadership commitment, because the group CEO is the key driver as well to endorsing the program. And in fact, when COVID-19 hit, he was, I would say he was very affected by COVID-19 and the effect of, lockdown and the mental health effect due to COVID-19. And he really understand the challenges that everyone faced during the COVID-19. And when we meet our leadership meeting, when we meet our leaders on a monthly basis during HSSE Council, the mental health agenda is always highlighted. And this coming from the top CEO, the top level of management, and driving it to all the VPs and the other CEOs of other companies, that basically drive the whole agenda, and it makes it easier for us to implement those programs. Yep.
Right.
Yep. And some of the budget, in fact, comes from the CEO. I think I remember one of the presenters mentioned earlier, health and well-being budget has to come from the CEO. Otherwise, many of this program will not be successful.
Right.
That's what is there in the WHO Healthy Workplace model. Leadership engagement, leadership involvement, both of them, they are necessary to have a successful implementation of the program.
True.
So any question from the learned audience? If you have any question from Dr. Albert. So
Very clear.
let me conclude by saying thank you to you.
Thank you so
and
much.
coming all the way from Malaysia. And you have given a very wide overview of your activities in your company. And no doubt it is very important to get involved with your management, with your workers, and with your colleagues, so that the things get implemented. Whatever is your wish, it should come true at the ground level. And that is the success of our work. And that is the success of occupational health at workplace. Thank you very much, Albert.